Hello. First of all, I must give you a bit of a warning. If you've never suffered from heavy periods, what you're about to hear may be both distressing and shocking. However, if you've had heavy periods or are still suffering from heavy periods, then it may be all too familiar.
I was getting through a box of tampons a day. I didn't really want to go out over those periods of time because I never knew when I was going to be flooding.
The first big bleed I had, I was at the hairdresser's and she'd just finished cutting my hair and we looked down and there was a huge pool of blood on the floor.
When I went to work one day, I arrived at work and by the time I'd arrived there I'd actually filled my own shoe with blood.
I woke up one night and I'd flooded the bed. The final straw was a few days later, got in the car to go to a meeting, and the next thing I knew I was sat in a pool of blood.
My symptoms ranged from very heavy periods, I was getting clotting, which was unusual, very swollen stomach, and just feeling extraordinarily tired.
In every single case you just heard, the heavy bleeding was a symptom of uterine fibroids. New research has shown that 45% of women are unaware that excessive menstrual bleeding is one of the main symptoms of uterine fibroids. The research was carried out by fibroidsconnect.com to highlight the lack of awareness and understanding about heavy menstrual bleeding and fibroids. Fibroids grow on or in the muscle layer of the womb and can vary in size considerably. Some are as small as a little pea, whereas others can be as large as a melon. They are the most common form of non-cancerous, that is benign, tumours in women, affecting 4 in 10 at some time in their life. Uterine fibroids occur most commonly in women aged between 30 and 50 years old, but they can occur in those both younger and older. 1 in 3 women experience symptoms from their fibroids, the most common being excessive heavy bleeding. The research also revealed that many women are unaware of the other symptoms of fibroids. 6 out of 10 women did not know that pelvic or abdominal pain and swelling, pain during sex, constipation and frequent urination can all be signs too. Fibroids can also impact on your ability to become pregnant and to carry a baby to full term. So it's therefore even more important not to ignore symptoms and to go and see your GP. The earlier fibroids are diagnosed, the easier they can be to treat. There are different treatment options available, some of which do not involve a hysterectomy or other major surgery that can affect future fertility. Fibroids can have a severe impact on quality of life, but despite this, many women wait up to 5 years before going to see a doctor. So the advice is quite simple. If you've got heavy periods or other possible symptoms of fibroids, don't ignore them and go and see your GP.